Hi, I'm Greg Martin. I'm Chief of Engagement, Dissemination, and Implementation here at the Patient-Centered Outcomes Research Institute, or PCORI, and I'm joined today by my colleague.
Hi everyone, I'm Carly Paterson. I'm an Associate Director with PCORI's Healthcare Delivery and Disparities Research Program.
We're delighted to join you today, all of our colleagues at the Southern Nursing Research Society. So PCORI, as you may know, is the leading funder of patient-centered comparative clinical effectiveness research in the United States. So we're an independent, nonprofit research institute that was established through an act of Congress to fund research that will help people and those who care for them make better informed healthcare decisions.
And so there are several key features of the work that PCORI funds. One is with comparative effectiveness research, we're focused on 2 or more comparators, and also a meaningful involvement of patients and stakeholders in the research process and the research that we fund to help make the most informed decisions for informing practice in the future. And so we're working to fill a public need because we know that patients, clinicians, and others in the healthcare ecosystem often don't have the information that they need to make the most informed healthcare decisions. And PCORI really does strive to fund real-world evidence generation that will help inform some of those decisions and inform the healthcare system in that way. So there are several criteria that PCORI-funded work must meet, and these cover the domains of scientific merit, a focus on the investigators and the environment, of course the critical evidence gap that any study funded would be filling, but then also an important focus on patient-centeredness and patient and stakeholder engagement.
And I'd like to linger for a moment on patient centricity and patient and community engagement. 2 very important areas for PCORI that applicants must address. It's possible for an application to be very patient-centered, but have no patient and community engagement. Likewise, it's possible to have great patient and community engagement, but little patient centricity. What we're looking for with patient-centeredness is an assurance that the question and the outcomes are really those that matter to patients, families, and those who care for them. With patient and community or stakeholder engagement, we're really looking to see those who have lived experience with a condition and those that are proximal and relevant to care for the condition are at the table as partners in the research process itself in a substantive and meaningful way. Now, what does PCORI's community of communities look like? These are those that we hope to see engaged around the table in any application and throughout the life cycle of any project. You'll see our true north at the top. Patients or consumers, families, caregivers, and patients and consumer advocates. These are the folks with the lived experience that enrich each application and project that we fund. Of course, there's also the critical partnership from researchers and clinicians like nurses yourselves. Those who can also contribute to a project include payers, purchasers or employers, hospitals and health systems, public policymakers, training institutions, and the life sciences industry. Again, we hope to see those that are proximal and relevant to the condition or topic in the application engaged in a meaningful and substantive way throughout the life cycle. Carly?
Great, thanks. And we'll just touch briefly, to date, PCORI, through all of the funding mechanisms that we have that cover both the engagement and research domains, nearly $4 billion across 2,000 research and research-related projects.
And we have several different funding opportunities we'll share with you today. I'd like to share a few that really provide an opportunity for communities and investigators to come together. There's our Engagement Awards capacity building funding opportunity. This is really there to help communities and investigators come together and build the skills to be those true partnerships in research. We also have the Dissemination Initiative, which supports communities in translating PCORI-funded evidence into a format, a language that resonates with their community. And we also have Convening Support Awards that help bring people together to explore what patient-centered CER may mean to them and their community. What about some of the research funding opportunities?
Yeah, sure. There are several these days. So we have our standing funding announcements, which are our broad pragmatic studies. We also have funds up to $22 million with our phased large awards for comparative effectiveness research. Those awards do require a feasibility phase. We also have funding in the methods and science of engagement domains. And then as well, at any time, there can also be topicals and targeteds going on for PCORI. So lots of opportunities for funding in different areas and through different kinds of mechanisms.
An additional one of those mechanisms, those are our Dissemination and Implementation Awards, which are available for current PCORI-funded investigators to support the dissemination and uptake of their PCORI-funded evidence, as well as a couple of open competition awards for those that are interested in PCORI-funded evidence and seeing how it can be spread and taken up into additional sites. We encourage you to check the website for current funding opportunities.
And we have several resources on the website. Aside from our funding opportunities, there's a lot of information about how to apply, what you would need to know to apply, resources around engagement, if that's something that's newer to you when it comes to conducting research, as well as a lot of information about methodology. And to echo Greg's point earlier, we would strongly encourage anyone who's interested to subscribe to PCORI's updates so that you're getting up-to-date information about funding announcements as well as any of the other events or PCORI-related work that's going on. And this is our contact information. We welcome you to join the conversation about PCORI or to get in touch with either one of us if you're interested in furthering the conversation around funding opportunities or anything related to PCORI.
And from a nurse spouse and a nurse,
Yeah.
thank you.
Thank you.